Hello, this is Alexandra Kosakowski narrating a brief educational session on horizontal violence in nursing practice. Watching this presentation fulfills the second participant requirement of my research study. Following this presentation, you will take an immediate post-test. The link to the post-test was provided on your work email. If you have any questions, please feel free to contact me on any of the methods provided on your work email. At the conclusion of this presentation, you will be able to define horizontal violence, recognize multiple forms of horizontal violence, inclusive of scapegoating, backstabbing, overt and covert verbal affront, and other subcategories, describe preventative strategies to combat horizontal violence, and identify the process for reporting horizontal violence in the workplace. Horizontal violence can be broadly defined as any unwanted abuse or hostility within the workplace. While this definition provides a basic description of the problem, it does not acknowledge the multiple subcategories of aforementioned violence. What one might perceive as harmless banter and teasing, another may interpret as offensive and degrading. Without proper training and education, the prevalence of horizontal violence will reach epidemic proportions. In order to understand this growing concern, we will review several forms of horizontal violence and provide clinical examples. Backstabbing, as the name implies, is often performed in private to mar someone's reputation or personal character. Backstabbing behavior would involve speaking negatively about a coworker behind his back or without him present to defend himself. Bickering refers to destructive, non-constructive arguments that serve no functional purpose. Broken confidences or commitments involve spreading information that was shared in confidence and intended to be kept private. If a nurse shares with her colleague about filing for divorce and asks for the information to be kept private, but the next morning the entire unit is offering condolences or advice, then this would be an example of broken confidence. Verbal affront involves the use of snide remarks or gestures, but then attempting to turn the situation into a joke. The difference between covert and overt affront is if the negative behavior in question is performed privately or publicly. Nonverbal negative innuendo describes the use of actions to convey aggression or other inappropriate behavior. Examples include eye-rolling, excessive sighing, eyebrow raising, or making sour expressions. Sabotage involves setting an individual up for failure. An example may include purposely not replacing continuous IV fluids for the oncoming nurse, so she starts her shift with several alarming pumps and subsequently falls behind on patient care. Scapegoating can be likened to the metaphor throwing someone under the bus. This behavior often involves blaming one individual for everything that goes wrong or could possibly go wrong. Undermining is a process of destroying one's confidence through negative remarks, embarrassment, or debasement. It can also refer to discrediting personal accomplishments or achievements. For example, if a nurse wins an award and another nurse comments that anyone with half a brain could have received that award, then he would be undermining her accomplishment as nothing more than an unimportant, trivial task. Once these forms of horizontal violence are recognized and understood, methods to combat the problem can be put into practice. This can best be accomplished with a multifaceted approach focused on cognitive restructuring techniques, a team-based approach, and immediate leadership involvement. Cognitive rehearsal techniques allow us to receive, process, and respond to acts of violence in a non-threatening, controlled manner. The purpose of these techniques are to identify the action or behavior that is aggressive, not the individual. By using I statements, focus is taken away from the individual and the de-escalation process may begin. For example, if you overhear a colleague gossiping about another nurse that is not working today, replying with a statement such as, "You shouldn't be talking about Nurse D, that's not fair," would be incorrect. This statement focuses on the individual performing a negative act, not the act itself. A better response would be, "It bothers me to hear you talking about Nurse D when she isn't here." When an act of horizontal violence occurs, it is best to respond with a team approach if possible. For example, if two employees are loudly arguing at the nurse's station, do not stand by and remain silent. Intervene with cognitive restructuring techniques to remind your colleagues that this is neither the appropriate time nor place to be having such a heated discussion. At times, even the most skilled person performing de-escalation techniques will need more than therapeutic communication to diffuse a situation. If a situation is becoming more dangerous, then immediate assistance from your direct supervisor or other leadership member should be sought out. Our organization has a strict policy on workplace violence and other forms of harassment. If an employee feels intimidated or threatened, this needs to be reported to a direct supervisor, such as an operations manager or a nursing supervisor on off shifts, and/or the Vice President of Human Resources and Support Services. Regardless if you are a witness or victim of horizontal violence, you must fill out a violent incident report form. This form will be used by the threat assessment team to investigate the incident of violence within 24 hours. Threat assessment team members include individuals with leadership and administrative positions within our organization. Members are comprised of representatives from Human Resources, the Employee Assistance Program, Security, Risk Management, and Administration. Anytime during the investigation, victims and witnesses may speak with the threat assessment team to provide additional information that may be beneficial to the case. Outcomes for aggressors vary on the severity and extent of violence, but may involve employee assistance programs, EAPs, or immediate termination. This concludes the presentation on horizontal violence in nursing practice. You have completed your second participant requirement in my study. You may now take the immediate post test to complete your third requirement. Thank you for your time and attention.